Hello, and welcome to Promise Zones, Rebuilding Communities for Health Equity. My name is Star Tiffany, and along with my colleague Joanna Hathaway, we will be running today's web forum. If you experience technical difficulties during this WebEx session, please dial 1-866-229-3239 for assistance. You may want to write that number down for future reference. The audio portion of the web forum can be heard through your computer speakers or a headset plugged into your computer. If at any time you are having technical difficulties regarding audio, please send a question in the Q&A panel, and Joanna or I will provide the teleconference information to you. Once the web forum ends today, a survey evaluation will open in a new window. Please take a moment to complete this evaluation, as we need your feedback to improve our web forums. We are encouraging you to ask questions throughout today's presentation. To do so, simply click the question mark icon, type your question in, and hit send. Please send your question to all panelists, and we will be addressing questions both throughout and at the end of the presentation. It is my pleasure to introduce our moderator for the day, Brian Smedley. Brian Smedley is Vice President and Director of the Health Policy Institute of the Joint Center for Political and Economic Studies in Washington, D.C. Formerly, Smedley was Research Director and co-founder of a communications research and policy organization, the Opportunity Agenda, which seeks to build the nation will to expand opportunity for all. Prior to helping launch the Opportunity Agenda, Smedley was a senior program officer in the Division of Health Sciences Policy of the Institute of Medicine. Smedley came to the IOM from the American Psychological Association, where he worked on a wide range of social, health, and education policy topics in his capacity as Director for Public Interest Policy. Dr. Smedley, please go ahead.
Great, thank you, Star. And thanks to everyone for joining us today. I'm very, very pleased to be joined by my colleagues, Judith Bell, President of PolicyLink, Luke Tate, Senior Policy Advisor for Urban Affairs and Economic Mobility with the White House Domestic Policy Council, and Dr. Rob Sampson. He's Henry Ford Professor of the Social Sciences at Harvard University and Director of the Boston Area Research Initiative. Before we get to our other panelists, I just want to say a bit about why we're convening here for this webinar on Promise Zones. And I'll say a bit about our agenda. Judith Bell and I will provide some opening remarks. Then we're going to hear from Luke Tate on what exactly the Promise Zones are, what are the criteria that communities will be judged upon application, and why we need this, why we need Promise Zones as a policy, and hopefully to begin to expand Promise Zones around the country. Dr. Sampson will speak to the evidence base. What do we know from research about the potential of Promise Zones to help reduce crime, stimulate economic activity, and improve health? And then we're going to make some asks of you all. We urge you to join us in this work, and Autumn Saxton-Ross from our staff will follow with more specifics about what we need folk to do to help ensure that Promise Zones becomes a reality. As Star mentioned, we'll be taking questions at the end of this webinar, so please, if you have a question, go ahead and write it in the Q&A box that you see on the lower right-hand corner. We'll have a few closing remarks, and then we'll roll up our sleeves and get to work. Let me just begin with a couple of remarks about why we think Promise Zones are very, very important as a strategy to advance health equity and to combat poverty. Most of us on this call know that there's a pretty powerful geography of opportunity in the United States. Where we live, work, and play powerfully determines our life opportunities. This is particularly true when it comes to socioeconomic mobility, access to good schools, access to good jobs, access to capital to start a business. These all vary tremendously according to where one lives. So President Obama, in his State of the Union address earlier this year, laid out an initiative to designate a number of high poverty communities as Promise Zones, where the federal government will partner with and invest in communities to create jobs, leverage private investment, increase economic activity, expand educational opportunities, and improve public safety. Now, we know, those of us that work in the health and health equity space, that these are all determinants of health, but really this webinar could be entitled Promise Zones, Expanding Opportunity for Socioeconomic Mobility in Every Community Around the Country. So it's not just a health equity intervention, but it's also about ensuring that every child can grow up to achieve their fullest potential. So as I said earlier, we're going to urge all of you who are on this webinar to help us join in this effort to raise awareness about the potential of Promise Zones. We've got quite a bit of work to do to ensure that many different stakeholders that are engaged in this effort are aware of Promise Zones. This includes grassroots and community-based organizations, researchers and scholars, policymakers, elected officials. We've got a lot of work to do to ensure that all of these stakeholders are aware of the potential of Promise Zones and are poised to act at the appropriate time. So that's the purpose of this webinar. I'm very, very pleased to turn this over to Judith Bell, President of PolicyLink. And one of the things that I think is important about this work is that PolicyLink has been a nationally innovative leader helping people to understand the imperative to expand opportunity for all and the rationale for equity as the superior growth model. So I want to commend Judith and PolicyLink and all of her colleagues for tremendous work to help advance the case that we cannot leave any community behind if we want to become and live up to our nation's creed as a land of opportunity. So Judith, I'll shoot it over to you.
Great, thanks so much, Brian. And just so excited to be working with the Joint Center and to be working with the White House to help build the knowledge about and the support for Promise Zones. And we're hoping that everyone will get engaged just the way Brian was describing, and that a good number of you will think about applying in your communities to be a part of the Promise Zones initiative. And you'll hear more about that from Luke Tate to tell you exactly what is happening with Promise Zones. We're just excited about the potential of Promise Zones. It's a natural fit with the work that we do here at PolicyLink, and I know a natural fit with many who are on the call today. We're focused at PolicyLink on making sure that every community is a community of opportunity. Our tagline of lifting up what works has us partnering with communities around the country, recognizing that local leaders are national leaders, and it's those local leaders that can help us figure out the elements so that each community can have the jobs, the housing, the good schools, transportation, the benefits of healthy food and physical activity, so that we can make sure that every community is a community of opportunity, and that those ladders of opportunity are present as well. Our work is grounded in the conviction that equity must drive all policy decisions. And we've been involved now really since the start of the Obama administration in several of the key place-based efforts that the administration has launched, from Sustainable Communities, which is focused on providing support for public agencies and communities so that they can plan for the integration of housing and transportation, infrastructure and environmental improvements, to healthy food financing, which works to increase access to healthy food in low-income communities and communities of color around the country, using a public-private partnership model so that there's new supermarkets and farmers markets and all sorts of other options. And then, of course, Promise Neighborhoods, which has been at the center of a lot of this work and has been the administration taking the work that Jeff Canada and the Harlem Children's Zone has done so successfully, taking the basic tenets and principles of that work and allowing communities around the country to take those and apply them and use them to make sure that every child can reach their full potential. And we've worked with Promise Neighborhoods around the country, helping them to implement the program and helping them to advance results for children in the low-income communities that they're working in. I know that all of you have joined us on the webinar because of your interest, and you each have a critical role in helping to build the knowledge and support for Promise Zones. It's really the work we're all doing that can make such a difference in the lives and outcomes for children and families who are often left behind, too often also unseen. And it's our work together that can advance health equity, ladders of opportunity for all. So we're just excited that Promise Zones can help us establish what children need and what parents need so that kids can do well, families can do well, communities can do well, and each can reach their full potential, can build their economic assets, and better able to meet their children's physical, emotional, and educational needs. So Promise Zones will connect families to the ladders of opportunity. It'll improve family economic success and children's futures. It'll help create jobs with family supporting wages, make neighborhoods safer by reducing violence, improve educational opportunities to allow all children to reach their full potential and create healthy and vibrant communities. It is an exciting moment to have Promise Zones being launched, to know that there will be an opportunity again coming up in 2014. And so we are honored and excited to be engaged in this work and look forward to continue to work with the Joint Center and with the White House and the administration. So with that, I'll turn it back to you, Brian. Thank you.
Great. Thank you, Judith. So at this point, we're going to turn it over to Luke Tate, Senior Policy Advisor for the White House Domestic Policy Council, to learn more about specifically what are Promise Zones, how will communities apply to become part of Promise Zones, and what's needed in order to realize this as a policy initiative that can fully take root. So at this point, I'm delighted to turn it over to Luke Tate.
Thank you, Brian. We really appreciate the opportunity from the Joint Center and Policy Link to be able to join you all today. In particular, we're excited to be able to talk with the hundreds of organizations that are represented on this call, organizations that are doing the work on the ground, organizations that are fighting for the changes that we need, the progress that we need in state houses around the country, and right here in Washington, pushing Congress and pushing us to continue the progress that we've made over the last few years. So I think this is exactly the team that we need to engage with and to be a part of, and we're grateful for all of you making time today. We know you've got a lot on your plate, so thank you for being with us. The reason we want to talk about Promise Zones today is really fundamental to the President's view of how we ought to approach our work here in Washington. We believe that there is a very basic bargain in America. It says that no matter who you are or where you're from, if you're willing to work hard and play by the rules, you should be able to find a good job. You should feel secure and safe in your community. You ought to be able to support your family. And the President believes that this should be true for all Americans, no matter where they live, no matter where they grew up. And that's why he's fighting to build ladders of opportunity for all Americans. Now, as Brian mentioned earlier, we know that more than 11 million people in America currently live in communities of highly concentrated poverty. We know that that has a profound effect on the opportunities they're exposed to, on the stresses in their lives, and we know that it determines for children growing up in those communities a great deal of the opportunities that they're afforded educationally, economically, and for their health in the long term. So from the beginning of this presidency, President Obama has focused on investing in innovative new ways in our highest poverty communities. Through programs like Choice Neighborhoods at HUD and Promise Neighborhoods at the Department of Education, we've invested hundreds of millions of dollars in more than 100 of the nation's persistent pockets of poverty since 2009. But as we came into the second term, what we heard from many of the folks on this call, in fact, many of the folks around the country who were doing this work, was that we had taken important, meaningful steps forward, but we needed to do better. And we needed to do better in two ways. One, we needed to make sure that the scale of our investment was more responsive to the scale of the need that we're seeing around the country. And so in the President's FY14 budget, as we'll note later, we have asked for significant increases from Congress, investing in the programs that we have that are working right now in the communities around the country, the communities that Judith and her team at PolicyLink are working with on the ground. We are seeing the impact of those Promise Neighborhoods, Choice Neighborhoods, and other tools that the federal government has made available over the last few years. But it's also become clear, and we heard from you loud and clear, that we needed to be better partners, that the federal government needed to exhibit an appropriate level of humility about our own role in revitalizing high poverty communities. And that's what we're trying to do through Promise Zones. Rather than asking local leaders of nonprofits, local mayors, local pastors to cast about the federal government, seeking the resources that they need in all the different thousands of corners that they exist, what we've said is we want to be a partner for the folks who have a good, strong, evidence-based plan to accomplish the key goals of Promise Zones, right there on the slide, to create jobs, to increase private investment and economic activity in the community, to improve the educational opportunities available for our youth, and to reduce violent crime where it is a scourge in our communities. And so what we're doing through the Promise Zones application process is inviting communities to tell us their strategy, to point to the evidence supporting the plan that they've chosen, to show how that plan is responsive to the needs and the assets, the strengths of their community from a human perspective and a market perspective, and to show us that they have a team in place who's ready to move right now, that they have the capacity necessary to carry out the plan they've proposed. And we're looking for urban, rural, and tribal communities to come forward to show us that. We'll designate 20 of those communities Promise Zones over the next 4 years. And we expect to name 5 of those communities by the end of this year, by the new year. And for each of those Promise Zones, what we're going to say is, rather than casting about the federal government, looking for the resources in all the different corners, unsure of whether and when you were going to be able to line them up, even if we had great, useful tools out there, like Choice Neighborhoods, Promise Neighborhoods, what have you, we're going to make sure now you have a partner in carrying out the plan that you've proposed. And so what that means is that across over 20 different federal resources at 9 or 10 different federal agencies, all of these listed in the frequently asked questions on our Promise Zones website, and I'll just mention right now, it's www.hud.gov/Promise Zones. That's www.hud.gov/Promise Zones. We're going to make sure that across all of those different resources and all the different federal agencies, that we get a federal team on the ground who can work with the Promise Zones, who can work with the local leaders to identify the federal resources necessary for carrying out the evidence-based plan for which they were competitively chosen, who can identify how to get the flexibility in existing federal funding, because in most of our communities where we're doing this work, we've got Title I money on the ground, we've got CDBG money on the ground, we've got all of these different federal acronyms of funding, but sometimes upwards of millions of dollars already on the ground, but not working as it could be to advance our goals. We're going to bring a federal team on the ground to be your partner in both making sure that existing funding is working more effectively and identifying the resources that are necessary for carrying out a strategic plan, and making sure you can access those resources through competitive preferences. It will be earned through the competitive selection of the Promise Zones. And then importantly, and this is something that the President thought was particularly important, we want to make sure that we're doing everything we can to incentivize private business investment and job growth in each Promise Zone, to make sure that everyone who is looking for a job, who's wanting to work hard, is able to find one. And the way that we have proposed doing that is building on the successful Empowerment Zones tax credit, improving it, making it easier to use, by layering in a Promise Zones tax credit over every single geography that we choose as a Promise Zone, that will provide both a tax credit for employing a resident of the zone, that will double that tax credit if the business who's employing them is also located within the zone, and will also provide tax incentives for capital investment within the zone for folks putting their money into these communities. That's the partnership that we have proposed to bring together all of the different investments that we've made across the Department of Justice, Education, HHS, HUD, USDA, and a number of others. Small Business Administration, labor, I could go on. And we're kicking off this level of partnership with the folks who are already moving rapidly in the work. Here in 2013, we have made eligible the existing grantees of some of the more innovative programs at work in this revitalization effort around the country. In future rounds, beginning next year, for the remainder of the 15 promise zones that we'll designate, we will be opening that competition to all communities who want to join. We have some clear criteria of who can apply. Local governments are welcome to apply, but they're also welcome to find a partner, a nonprofit organization who they think would be better positioned to bring all of the folks in the community together. We've got some clear qualifying criteria. I'm going to move past the slide in a little bit, but all of these are again listed on the HUD.gov /Promise Zones website. The main point of our criteria is we want to make sure that we're focusing this sort of an intensive effort and this sort of an intensive investment in the communities that need it most, the communities where private capital has disinvested over a period of decades, where joblessness and violence and other social challenges and stresses continue to limit the opportunities available to children growing up in those communities. On the rural side, as you can see, and the tribal side, we have a very similar structure where local government or tribal government can either apply directly or in partnership with a nonprofit entity. And we have similar qualifying criteria, as I mentioned before, to make sure that we're targeting this sort of an intensive investment. Now, as I said, the president has requested over $300 million for Promise Neighborhoods, $400 million for Choice Neighborhoods, and $35 million for the Burn Criminal Justice Innovation Program. All of these significant increases over previous budget requests. And he has also proposed in his 2014 revenue proposals the Promise Zone tax credit, which would be worth billions of dollars of employment incentives and investment incentives in the Promise Zones all around the country. We've seen that it works. We've seen from Pat Klein and other folks who have studied the empowerment zones that they were effective in addressing the challenges of joblessness and concentrated joblessness. So we are incredibly hopeful and excited for the potential of working with the Promise Zones around the country. We can't wait to meet, first select and meet our 5 new partners this year. And we're hoping that in the hundreds of communities that are represented on this call, that folks come together in 2014 and identify their strategic plan, bringing together all of the right folks across their community with a commitment to creating jobs, increasing economic activity, improving educational opportunities, and reducing violent crime. And one of the things that I'll note that we think is critically important here is that we view this as an important first step. 20 Promise Zones across the country is not going to, in and of itself as a program or an approach, solve the challenges of 11 million Americans living in concentrated poverty. And we have an array of proposals, an array of work that has already gotten done across the administration to address that. But we also think that this effort will demonstrate to Congress, will demonstrate to future administrations, will demonstrate to your governors and your mayors that not only is investment in high poverty communities important and the morally right thing to do, but we can achieve exactly the goals that we set out to when we get a good strategic plan in place, when we manage toward that plan, when we carefully track our outcomes and our data, and ensure that we are at every point in the process holding ourselves accountable to the results that we have set out on the front end. And it's our view that that will lead to continued investment and better, more humble federal partnership in these local efforts around the country in the years to come. So we're incredibly excited about joining with PolicyLink, with the Joint Center, with our 5 Promise Zones to come, and the 15 more throughout the rest of this term. And we hope that you and your communities are part of that effort. Thank you again for making the time.
Thank you so much, Luke. At this point, we're going to turn to hear from Dr. Rob Sampson at Harvard University about the evidence base for place-based investments. As Luke touched upon, we know that empowerment zones worked, but to what extent will promise zones achieve the goals that have been outlined in terms of improving health status, improving economic activity, reducing crime, et cetera? So for that, we're going to turn to Dr. Sampson.
Hello. Thank you. It's really a pleasure to be on this call and this important initiative. So what I thought I'd do is to talk a bit about the evidence on neighborhood poverty and then segue into a more specific discussion of promise zones. I think it's really important to set the context for what kinds of issues and challenges face promise zones. And in fact, a lot of the organizations and people on the call thinking about proposals and setting up promise zones, I believe it's important to really nail the evidence base on neighborhood inequality. We know, first off, that it's one thing to be poor and it's quite another to be poor in a poor neighborhood. That is the concentration of poverty. But I think there's some other facts that really need to be stressed. First of all, it's not just poverty that's concentrated. Poverty tends to come bound up with a number of other social phenomena. What William Julius Wilson famously described in The Truly Disadvantaged, what he called social dislocations. We can think of the correlation of poverty, for example, with things like unemployment, female-headed families. We also know that poverty, unfortunately, is connected to racial segregation. The phenomenon of poverty is quite different. African Americans live in communities that are much poorer on average than whites. Even middle-class African Americans live in neighborhoods of lower income than do whites, even if you control for differences in income. Furthermore, the relationship of concentrated poverty is one that goes well beyond just material factors of unemployment, of money, and even of racial segregation. And it touches on really what I think of as the fundamentals of well-being, things such as health. If you take any number of indicators, whether it be low birth weight, if you take something like infant mortality, life expectancy, these too are highly concentrated in time and space, particularly neighborhoods of concentrated poverty. Furthermore, we can think about institutional factors such as incarceration and arrest patterns. We can look at violence patterns, and these I think are especially important because poor communities are disproportionately victimized by violence, and the evidence is quite clear that exposure to violence is quite a risk factor. For example, recent research has shown that exposure to violence among young children is related to declines in learning, and that these have lagged or long-term effects, developmental effects. So one of the issues of promise zones then is that it really presents an opportunity to deal not just with poverty, but with its confluence of factors. And then the second key fact is the persistence of neighborhood poverty over long periods of time, really the legacies of inequality. It's not just that individuals that grow up in poverty tend to also reside in poverty as adults, if you think about the transmission of poverty across generations, but also neighborhoods themselves tend to be quite persistent, more so than we think. So for example, a neighborhood at one point in time tends to have a sticky quality to it, and it's really hard to get out of that poverty trap. And the promise of promise zones, if I can put it that way, is to try to break that trap. I thought it'd be useful to maybe look at some of these things in a visual sense. So let me just quickly go to the next slide and have you look at two of the phenomena I just mentioned. Number one, the concentration of poverty and its correlates. In this case, looking at violence, particularly the murder rate, which is indicated by the stars. The larger the star, the greater the homicide rate in that particular community. But what's distressing about this map, and this is a map of Chicago, the different community areas in Chicago, is that I've also shaded these areas by child health, specifically infant mortality and low birth weight. At first blush, really what could be more different than a woman giving birth to a baby that's below a desirable weight, or infant mortality and homicide, usually between two males? Well, they're highly connected. Where you have high murder rates, where the stars are larger, child health is low. And furthermore, we know that, again, the exposure to violence among children has lasting impact. And you might think this is only a poverty story, but it's not. It's actually the case that these things are connected, even adjusting for poverty. So it tells us then that there are a coalescence of important factors in communities that need to be attacked. It's not just Chicago. If we go to the next slide, we see the persistence of poverty, in this case in New York City, our largest city, but also the site, one of 5 sites, of another attempt to address poverty, the Moving to Opportunity experiment by Housing and Urban Development, that gave vouchers to poor people to move to lower poverty neighborhoods. And what is seen in this slide is the relationship between poverty at an earlier point in time, specifically in 1995. The dots are, black dots are neighborhoods over 31.4% in poverty. And these are neighborhoods that really represent more or less the average of where the voucher movers ended up. So what it tells us is that even with help from the government, it's very much a constrained and economically segregated world, in this case in New York City, that again is quite persistent over time. The colors show the poverty rate in 2005 to 2009. The red areas are high poverty. And you can see pockets of poverty that have almost a durable imprint. This is the context that Promise Zones enters, and I think we can really summarize it with 3 facts. 1, the spatial inequality of the neighborhood concentration. 2nd, this goes across diverse social phenomenon. Things tend to go together. That provides insight for thinking about how to design Promise Zones and also the promise, but it does speak to a challenge, and I'll mention a few other challenges in a moment. And 3rd, the persistence despite change and the sense in which poverty is really part of a larger picture of spatial inequality in the city. So I'd like to talk a little bit about challenges and opportunities for Promise Zones and the new social transformation of the city. But before that, I think it's useful to discuss a little bit what we know about different policies to attack concentration of poverty. At a very basic level, it's useful to think of person-based and place-based initiatives. I've already mentioned some attempts to get at policy that attack poverty from a person-based approach. So, for example, we can give vouchers to individuals, as was done in the Moving to Opportunity experiment, and that has a major program that has been undertaken, and there's a lot of interesting research showing that moving to lower poverty neighborhoods has some positive benefits, particularly with regard to mental health and physical health. Not so much when it comes to income and jobs. Place-based initiatives, one can really think about those from a number of different perspectives, and it's useful to consider them within the context of Promise Zones. So we have, first of all, as many on the call know, that the government and policies, particularly in cities around the country, have addressed public housing, often in a place-based manner with regard to shifting residents out of neighborhoods and dealing with the teardown of public housing. This has gone on in many cities, although it's highly variable. Chicago, for example, has seen probably more than most cities. And there's also issues of dealing with vacant housing at a place-based level. There are comprehensive community change initiatives that have been undertaken in many cities around the country. There are programs such as the New Communities Program, the MacArthur Foundation. There are attempts to deal with specific communities, for example, Sandtown in Baltimore, Pockettown in Chicago has seen interventions. And we've also seen what you might think of as holistic attempts to intervene in specific places that have a real sort of theoretical connection to what Promise Zones is attempting to undertake, such as the Harlem Children's Zone, and this was mentioned earlier in the call. In this case, you have literally the marking off of a zone or neighborhood, in this case Harlem in New York City, and the provision of community services, education, really almost A to Z of interventions in a specific community. There are studies underway evaluating Harlem Children's Zone. There's been some studies already that suggest, particularly from the perspective of test scores, that the improved education in the Harlem Children's Zone has led to large increases in test scores. Other outcomes, we are not really sure, and in fact, I think that's often true of some of the research on thinking about comprehensive community change initiatives and also empowerment zones, because there the evaluations so far have been mainly focused on jobs. And while the evaluation literature is not large, as was suggested earlier, the evidence is fairly encouraging on empowerment zones in terms of ability to provide an increase in jobs. What we don't really know is the extent to which there are spillover effects to these other social phenomena that I've been emphasizing. That is to say, we're keenly interested in jobs and economic development, but health, well-being, crime, fear, disorder, these are also fundamental to social life and to the vibrancy of neighborhoods. So as a social scientist, as I look at the evaluations that have been done on these programs, and there haven't been a lot, frankly, there's not a lot of literature on these various programs, but what has been done is promising and encouraging. And what it suggests is that we really need to build on that with regard to thinking through the possibilities for promise zones. The challenges, but also potential for promise zones, I think, is suggested in various transformations that are going on in the United States and cities around the country. And I thought I would mention a couple of those and perhaps conclude with them, because in designing promise zones, we have to confront a number of things that have happened. First is the suburbanization of poverty. If you think about it, the kinds of neighborhoods that were studied by scholars such as William Julius Wilson and the Truly Disadvantaged, and the focus on inner city is really something that has changed in the following sense. The increases in poverty have been greatest in areas outside the central city in recent years. And that's why I think it's fundamentally important that Promise Zones is taking a broad view of all this, and including rural areas, as was noted. Poverty is not limited to the inner city. It's increasingly a problem of suburbs, and it has been a problem in rural areas for a while. But we're seeing big secular changes in this. Secondly, gentrification and the public housing revolution. It's clear that vacancies in certain cities are a major problem. In fact, many of you may have seen the article in the New York Times yesterday on raising vacant housing as a kind of intervention. Some cities desperate to deal with vacancies, a crucial issue, I think, that needs to be considered, but also the extent to which development and gentrification are changing many neighborhoods and cities. And this ties back to the issue of the persistence of poverty that some communities that are poor are seeing changes that we haven't seen for a while in terms of turnarounds of communities, and the extent to which we can link to the changes with regard to gentrification and public housing and vacant housing in particular, I think will be fundamental. Third is Great Recession is obviously another challenge, but what research suggests is that it may be even more important than we thought with regard to the most vulnerable communities. In recent research, it's been found that increases, for example, in vacancy rates, unemployment, poverty rates have gone up at a sharper rate in the most disadvantaged communities. Another way to think of it is that the neighborhoods that, for example, had the highest joblessness rates saw greater increases than did lower employment or lower unemployment neighborhoods. So what that's telling us then is that the Great Recession has not really been equal in terms of its effects. It's an unequal sharing of burden, which means that the promise zones are really going into a situation where the most vulnerable communities among us have in very recent years seen a setback. And I think that's crucial for thinking through the design and evaluation of promise zones. There are some, I think, almost historic opportunities. The historic crime decline here, I think, provides a window of hope and opportunity. We've seen declines in violence in the United States, and really on a level that we haven't seen for a long time. And that means that there's increased hope and, I think, a willingness of people to invest in neighborhoods that we didn't see even as short as 10, 15 years ago. And so community-based interventions that are tied to violence in the sense of both keeping the reductions in place and maybe even pushing for further reductions is crucially important, because once again, the connection of violence to the unraveling of communities is something that the evidence, I think, is quite clear on. So therefore, the kinds of interventions that are going to be designed for promise zones really need to focus in on safety and maintaining the declines, and in communities that perhaps have not seen the sorts of declines that have been taking place in cities like New York and actually many cities, although there are clearly pockets of violence in cities around the United States that haven't seen the sorts of declines that we'd like. We need to build that in. Finally, the immigration boom. Historic increases there, about a 50% increase since the 1990s, and leading to the revitalization of a number of neighborhoods and cities around the country. And the reason I raise this is what it means is that the face of the cities is changing. The nature of poverty, again, in terms of suburbanization, the composition of cities is rapidly changing. So these are some of the facts that I think point both to the challenges but also the promises of the program that's now before us in terms of thinking through the evidence and putting it to good use and really designing the programs such that they are able to capitalize on social scientific knowledge to move forward. So I hope this has been useful in providing the backdrop of evidence to both the nature of neighborhood inequality in the United States and the nature of the evidence, which, although limited in terms of community-based interventions, I think provides a signpost and a hopeful one at that in terms of moving forward. Thank you.
Great. Thank you, Dr. Sampson. I just want to remind folks that you can pose a question in the Q&A box in the lower right-hand section of your screen. There are already some questions coming in. I can clear up one question that's appeared several times now, and that is that people are hungering to get these slides and to hear and view a re-recording of this webinar, and that will be available on the Dialogue for Health website give STAR and the staff at Dialogue for Health a few days. I believe STAR projects that they can come up at some point next week. So hopefully that will make it easier for folks that are trying to take notes and capture this great conversation. Next, we're going to hear about what we need to have you all do. We really want each of you to take on the responsibility of helping to share information about promise zones, to make sure that stakeholders and key audiences know about and are enthusiastic about promise zones. So to do that, we're going to turn to our own Dr. Autumn Saxton-Ross, a program director here at the Joint Center for Political and Economic Studies. Autumn?
Thank you, Brian. And I want to say thank you for everyone for attending this webinar. Promise zones is something that's very important, and what we say here at the Health Policy Institute is that all policy is health policy, and so we believe that the promise zone fits within that. So just a few things for everyone to better understand what our purpose, this partnership between the Joint Center and Policy Link is. We are here to really help build public awareness and support of such an innovative and important initiative for communities that unfortunately have had so many issues and been disinvested in for so many years within our country. So just quickly, the first thing that we are working on doing is having stakeholder engagement. So those of you that are representing organizations and community-based organizations, and those of you that are individuals, we are starting to have monthly stakeholder meetings. And in this, what we're doing is actually having action items for you to help us build that public awareness and support. The way that this is going to be organized is through 4 committees. We have the Policy Committee, the Communications Committee, the Outreach Committee, and the Research Committee. And these committees are basically going to be able to help us get the word out and build support for a promise zone. So just quickly, the policy is to really help refine the idea of promise zones initiatives and the suggestion of additional considerations, but then to also really help frame how this goes over the next few years. The Communications Committee will help develop message and implement the blueprint strategy. What we're really looking to do is to start to engage more through social media, but then to also help us with push calendars to really organize around important events that you have within your local communities, important events that are happening nationally, and helping us to tie those in to build that public awareness. The third committee, the Outreach Committee, is to continue to expand the stakeholder group and to share this information. So if you know of people that were not able to attend this webinar, or know of people that would be really instrumental and important in advancing awareness about promise zones within your communities, that would be something that the Outreach Committee would do, and also to help us when planning day of actions and events around promise zones. Last but not least is the Research Committee, and that's to really help and to build upon what we've heard some of today, how to start to build an evidence base for promise zones and similar efforts to really help people better understand why community development, why community revitalization, why looking at a community really improves the health not only of that community but of individuals. So what you can do, of course, and these are a lot of questions that we've been having come in this afternoon, is to share this information around promise zones to get to know a little bit more about promise zones, but also choice neighborhoods and promise neighborhoods, and if there are initiatives like that within your communities, and to share this information with your colleagues and networks. Join a committee. We can always use as much help as we can. As Brian says quite often, is if you've seen one community, you've seen one community. We can strategize and we can think about how to get this information out, but you, those of you that work in your communities, know the best way to get this information to your community. So we would love for you to start to join and help us with our stakeholder meetings and join a committee. You can email myself at Saxton-Ross at Joint Center, or you can email my colleague Lisa Seiler-Miller, lisacm@policylink.org, and that information is on this slide. So right now, that's basically where we are. I just wanted to make sure that everyone also knows that the webinar attendees, those of you that have signed up, you'll be added to our listserv so that you'll continue to get more information about Promise Zones from the Joint Center and Policy Link. And then I want to hand it over to Brian.
Great, thanks, Autumn. So there are some questions that are coming in. Again, if you have questions, please type them into the Q&A box in the lower right-hand corner of your screen. There are a couple of questions that reflect some confusion about the status of Promise Zones to date. One questioner writes, it sounds like there are already Promise communities. Will we see the names of those communities? So this question I want to direct to either Luke or Judith, because it sounds like people are confused about the fact that there are already existing Promise neighborhoods, which, as Judith indicated and Luke indicated, is modeled after the Harlem Children's Zone. I have the list of those Promise neighborhoods implementation grants in front of me, but I wanted to first see Luke or Judith if you wanted to respond about the currently funded Promise neighborhoods and the fact that no Promise Zones grants have been extended as yet.
Sure, this is Luke, and I'll
Go ahead,
jump in.
Luke.
Oh, sorry. Go ahead, Judith.
No, it's fine.
All right. So as Brian noted, the Department of Education built the Promise Neighborhoods model based on what Jeffrey Canada and his team, his incredible team, have accomplished in Harlem. And that model and the funding provided through that program is intended to support the cradle-to-career continuum that is centered around a school, but includes the community supports all the way from baby college to college access, from 0 to 18. And we view that as one of the critical tools that we'll be making available through Promise Zones. So that Department of Education program, where we've got amazing grantees working around the country right now, is a program that we want to make sure, among others, including housing, public safety, and other federal resources, that we are making available to the Promise Zones. In addition, the existing Promise Neighborhoods implementation grantees are a part of the cohort that is eligible to apply for the first round of Promise Zone designations, the first 5, but they will be in the same competition as everybody else that any community in the country can apply in 2014 and going forward for the next 15 designations.
Great, thanks for that, Luke. There's a related question. To be eligible to apply as a Promise Zone, does an applicant need to be a current Promise Neighborhood grantee, planning or implementation, ? Or can a former grantee apply? So Luke, I'm going to guess that this would be appropriate for you.
Sure. So as I said, in the first 5 Promise Zones, we're really ensuring that this federal partnership, this sort of better, more engaged partnership, is something that we can build on the existing work that's happening around the country. And so for these first 5 designations alone, the eligible set of urban applicants are the Promise Neighborhoods implementation grantees, the Choice Neighborhoods implementation grantees, and the Burn Criminal Justice innovation grantees out of DOJ, recognizing that rural and tribal communities are often not going to access those programs for all sorts of reasons, but including that those are not always the right tools, or at least not all of those are the right tools. We have extended eligibility to even more rural and tribal communities who are part of other programs that are engaged in similar efforts, including Stronger Economies Together. And the complete list is available on the Promise Zones webpage, which is, again, www.hud.gov/Promise Zones.
Terrific. Thank you, Luke. There's another related question. The questioner writes, what about rural communities in poverty? Our county is sparsely populated with a total population of about 50,000, and about half of kids qualify for free school meals, and their opportunities are meager. So I want to open it up to any of our panelists to respond. I think this question comes in part because much of the conversation today has focused on urban concentrated poverty, but it's certainly true that there are similar challenges in rural communities. And as you just heard Luke say, rural communities will certainly be eligible for promise zones. But let me open this up for any of our panelists to comment or add a little bit more depth about some of the challenges in rural communities.
Well, this is Judith. I would just say that the questioner is right, that of course there are challenges in poor rural communities as well, and that promise zones will have that eligibility. Promise neighborhoods did, sustainable communities did as well, and in each case they recognize the fact that the challenges in rural communities are different. And so I think the administration, Obama administration, is to be commended for recognizing the differences in the geography of poverty and the fact that these tools can be applied, but that they'll be applied in different ways. And so in the Promise Zones competition, there'll be that opportunity for rural communities as well, and they'll be able to come up with their plans, their results, focus, and those other elements and compete for that designation as well.
Great, thank you, Judith. Another question, and I'm going to read it verbatim. Discuss opportunities to leverage investments in promise zones to engage private, parentheses, venture capital, question mark, investment, social impact investment. So this is a question that I'll open up for, again, any of our panelists on the potential of these place-based investments to attract and leverage private investment.
This is Robert Sampson. Just a quick comment on that. I think it's a really good question. I guess the way I would look at that is to go back to some of the facts that I was talking about earlier with regard to the social characteristics of neighborhoods and the extent to which businesses and private investment, I think, are keenly aware of the trends in communities and would be willing to invest more to the extent that the promise zones can, for example, keep the trajectory on the right track. It's not just levels of poverty, and in fact, there's a lot of opportunities in poor areas, and this has been an issue that's been put out there for a while in terms of investment in the inner city. But we do know that population loss, increases in crime rates are related to migration away and the unwillingness of businesses to invest. So I think there's a great opportunity actually for companies, private capital, to put a stake in communities that they wouldn't otherwise. With regard to kind of a partnership, maybe not a formal partnership, but nonetheless, I think this is something that really is a creative possibility. So I think it's a great question and worth pursuing.
Great, thank you, Dr. Sampson. And particularly, this is why the tax incentive is so critically important that Congress pass that, because obviously that would sweeten the pot for private capital and private investment, so that there are tax incentives to minimize risk and to attract more investment. Luke, I have two application process related questions that I'm going to combine. They are actually from two different questioners, but I figured that this would be an opportunity for you to address some of these. One is, what is the time frame for the committee to work and for applying for promise zones? That's one question. And then another process-related question, can a county government or other partner write letters of support to potentially partner with two different promise zones proposals submitted by different lead applicants?
Are due back to the...
yeah, I'll reread them. I'm sorry. So the first question is, what's the time frame?
Sorry, I've got it.
Okay.
So I can definitely address the first one. The applications are due back to HUD and the interagency team that is scoring them on November 26th. And they expect to be able to score them and have announcements by the end of this year. That's the timeline we're on. As far as the specific application questions around endorsement and how folks can apply, we have thought it's really important to send a very, very clear signal that this is going to be an apolitical and evidence-based selection process. The White House is not going to be in any way involved in the application selection process. We have asked our interagency team to tackle that, and so any specific questions about how a local government or a county government should engage in the application would be best directed to that team. I think they've done an amazing job of turning around the responses to those questions and including them in the frequently asked questions document, which is being constantly updated on that web page we talked about earlier, www.hud.gov/promisezones. So I would encourage you to send your question there and expect a very prompt response.
Great. Another application process related question. The questioner writes, my organization is not appropriate for the lead position. Is there a way to know which agencies are applying in order to collaborate and offer programs/services to strengthen a zone plan?
Yep, so all of the eligible applicants for 2013 are listed in that frequently asked questions document on the hud.gov/promisezones website. You will be able to see exactly who in your state or in your community are eligible for application this year. I know the interagency team has done a tremendous job of reaching out directly to all of those folks. So we are hoping and expecting that all of them are applying this year, and would encourage you to contact them directly. In future rounds, we would expect that there's going to be a broad range of communities applying. So it would really be whoever in your community, your organization thought would make the best or most appropriate lead organization that you would want to be reaching out to. And I think it's really important for all the organizations on the call who wouldn't be a lead organization but feel like they could contribute an important component to the application, to take a look at the application that's online and to point out, whether it's to your mayor's office or your county economic development board, how that application actually really does score not just the lead, but all of the critical partners who are part of the effort, and how bringing you into the team could really help their application chances.
Excellent, thank you. Here's another question. Is there a way to connect this effort with the Quality Improvement Initiative at HRSA, the Health Resources and Services Administration, to reduce infant mortality? All Region 5 states are planning to seek out strategies addressing social determinants.
This is Luke again. We have a number of different, as many of the folks on this call are aware, because you're carrying them out, a number of different efforts underway across the federal government that address many of the same components of community health and well-being that Promise Zones are trying to bring together. If there is a particular resource available that folks think are is critical to include for the Promise Zones in order for them to achieve the goals that the President has laid out, that's the kind of input and feedback that we need. This is going to be an iterative process of, again, making sure that our partnership is responsive to the needs of local communities. The identification of those types of resources is really helpful to us, and we'll be listening closely to the Promise Zones who are selected to make sure that we're tying relevant efforts together for them, including those that you mentioned.
Yeah, that's great. Thank you, Luke. And of course, anybody working in the health equity space knows that this kind of effort to address concentrated poverty, to stimulate economic activity, to increase jobs, reduce crime, all of these are health equity interventions that in all likelihood would reduce infant mortality, but we certainly will need to have good evaluation data on that. But it adds to the importance of the Promise Zones initiative as a strategy to truly get at some of the root causes of the huge infant mortality gaps on the basis of race and socioeconomic status. Here's a statement from someone, and I want to read the statement because I think it's an important concern, and I think we have an opportunity here to address this concern. The person writes, we saw the quote-unquote shovel-ready doctrine during the ARRA, so that's the stimulus legislation. We're constantly hearing organizations that demonstrate capacity. We saw it with the Sustainable Communities Initiative, and low wealth and communities of color are repeatedly being excluded. So any of our panelists want to address the concern that low wealth communities and communities of color are being excluded from related opportunities?
Well, I'm sure the other panelists will want to jump in as well, but this is Luke. Just wanted to note that clearly as we've designed this program and this approach, this partnership, it's targeted exactly to those communities. We know that it's important to meet communities where they are. So while not every community in the country is ready to embark upon an ambitious and complex approach, we think it's important, and through Promise Zones are ensuring that we have resources available for every community that is working toward that. We're planning on providing those largely through the planning grants, through Choice Neighborhoods and Promise Neighborhoods, and also the identification of Promise Zone finalists that can help the communities that are ready to work but haven't yet gotten all of their team in place to begin to build that capacity. I think we've seen incredible growth from communities around the country as PolicyLink in particular, but other organizations have worked to build capacity in those communities just in the last 4 and 5 years through the Promise Neighborhoods and Sustainable Communities efforts. But to be explicitly clear, Promise Zones is targeted at exactly and will be identified, the folks who will be identified as Promise Zones are the low-income communities who you're talking about.
And I just want to add, this, Judith, that I think what's been so commendable by the Obama administration is the suite of approaches. And so that depending on where a community is at, depending on what it has recognized as a need that it is positioned to fulfill, there are multiple programs, multiple grants, multiple loans, multiple ways to use different tools to approach them. So Luke's mentioned both Promise Neighborhoods and Sustainable Communities, but Burn Criminal Justice Initiative is one around criminal justice issues. There are programs around access to healthy food. You could keep going in the different tools that are available for low-income communities, communities of color, to approach any number of different challenges and to build off of assets that those communities are embracing.
And one in particular that I would just want to mention for folks to take a look at, because again, we thought that we know, as everyone on this phone knows, it's critically important for us to meet communities where they are. We developed the Building Neighborhood Capacity Program for those who are really just in the beginning stages of addressing the same types of challenges of social distress that Dr. Sampson was discussing in his presentation. And in Flint, in Fresno, around the country, the folks who have taken advantage of that opportunity are getting more and more ready to get more aggressive, more ambitious with the efforts that they're taking on, and they're seeing progress on a day-to-day basis. And that's the kind of solution that we want to be able to make available for all communities. So as Judith says, they have the tool that's appropriate for where they are and what they're trying to accomplish.
This is Robert Sampson. I just want to jump in. I think the comments of Judith and Luke are really important and encouraging because the communities that are very disadvantaged and that have had a history of disadvantage are also some of the ones that have high levels of distrust. I could put up maps and show not just infant mortality and violence, but the sense in which residents are oftentimes mistrustful because of past disinvestments, because of declines. And I think it just points to the importance of taking the history of how communities have gotten to the point where they are and how designing interventions needs to be sensitive, not just, again, to the level of poverty in the community, but the role of institutions. And in particular with Promise Zones, what's so interesting about it is the extent to which it seeks to induce collaboration among different organizations and really among residents in the community. The way I view that as a social scientist is that it's really trying to build a certain kind of cultural and social capital, organizational cohesion in the community. And so the issues of trust are very important, and I think it's understandable why there are concerns about that, and I'm really glad that it's come up.
I want to add one other thing to what Dr. Sampson just said. It gets back to something Luke said earlier, but I think it's critical, and it's tied in with this issue of trust, and that's been the way that the Obama administration has been embracing the need for a focus on results. And we see that in a number of different programs. I think it's that focus on results that can build the trust and the sense of accountability that programs will deliver. And that they'll be in a constant feedback loop, evaluating what's working and what's not, and making adjustments. It's that, I think, focus on results that can make a difference in trust and make a difference in outcomes.
Great. Thank you all. That was a great response to a very important concern. There are a couple of questions on promised neighborhoods. One writes, where can I find your definition of promised neighborhoods? And another writes, where can I find a listing of promised neighborhoods grants? And Luke, I'll let you take this, but I assume that all of this is available at HUD/Promise Zones.
So the listings of the existing Promised Neighborhoods grantees, the Department of Education program, are available on the Department of Education website. And actually, if you just put Promised Neighborhoods in Google, it'll be the first site that comes up. But as far as the goals that we're setting for the Promised Zones and what we're looking for in the applications, yes, those are all at www.hud.gov/promise zones.
Great. And the actual promised neighborhoods, the list I have here, they're scattered around the country: Chula Vista, California; Lubbock, Texas; here in D.C., Indianola, Mississippi; Los Angeles; San Francisco; San Antonio, Minneapolis; Hayward; Buffalo, New York, really across the country. And as Luke says, if you just Google promised neighborhoods, you can get that information. So at this point, there are no additional questions that I can see, unless I've missed one star, but it looks like we have addressed almost all, if not all, of the questions. I'll let folk have another minute or two if there are any other urgent questions that people want to type into the Q&A box in the lower right-hand corner. And I'm just checking through quickly. Here's one last question, which I missed, so I apologize. The question is there any dialogue to connect Promise Zones with the state innovation model, and particularly with the accountable communities for health? So again, I pose that to any of our panelists.
Well, I think that's the opportunity for communities as they look at the Promise Zone application to see what is underway, where they want to build additional capacity, and then to look at what Promise Zones brings to the table to see whether or not there are the programs and the resources that could advance just that kind of initiative. I mean, that is the flexibility in Promise Zones. It is what Luke was stressing about meeting communities where they are. So it allows the community to draft the plan, the community to identify the focus, and then to look at the different programs that are available through Promise Zones to make sure that the resources and tools are there to bring new and better results. And so I encourage folks to look at the information about Promise Zones, to look at that list of programs that are available, and then to think about what they're focused on and to see whether or not it's a match for the Promise Zone program.
Excellent. So there are no further questions that I see in the Q&A box. So at this point, I want to thank our terrific panelists, Judith Bell with PolicyLink, Luke Tate with the White House Domestic Policy Council, Robert Sampson with Harvard University, Autumn Saxton Ross of the Joint Center. And I want to give a particular shout of thanks to Star Tiffany and the great folks at Dialogue for Health. Thank all of you panelists and Star and your team, and thank all of you listeners and participants in this webinar. Please stay tuned, and again, please join us in this effort to raise awareness and build support for Promise Zones. Thank you.